Welcome, everyone. Thank you so much for joining this session. This is in-person versus virtual. That is the question. And it seems to be the magic question for a lot of things besides chapters, isn't it? So we wonder whether we should be going in person and what the effect of COVID is on all of this and whether you agree with the COVID thing or not. I mean, this is the world in which we live right now. And so how do we navigate that as DBSA chapter people? Now, the intention of this session is not to tell you what to do because I can't, because chapters are all separately incorporated, but just to brainstorm some ideas and things you need to think about as chapters. Like what would really be on your plate as you consider this question of going back. And so I already sort of introduced Miss Nicole. She is part of our peer apprentice program. You want to just give them a quick introduction of yourself? She's our Zoom jockey.
Oh, good.
Yes, good afternoon, everybody. I am Nicole Bowden. I'm a peer apprentice with DBSA, and it is such an honor. I don't even know where to begin with DBSA. They're a great organization. I'm just so happy to be a part of them, and this is just like, not a job. This is a part of my life, and DBSA is becoming a part of my family. They accept me, they welcome me. I don't know where else to go, but I'm pretty sure you guys are very familiar with DBSA way longer than me. And you guys know of their reputation. They're great, and I'm just happy to be a part of them. I'm excited for this journey that I'm on also.
Yeah, you're speaking to the choir here. So anyway, with that, I'd like to jump into the content of this particular session. So I'm going to share my screen to just talk a little bit about some talking points. First, I want to talk about our learning objectives, which you saw in the printed material or the pseudo printed material. But at the end of the session, we want you to be able to name 3 considerations when making a decision to return to in-person. Learn at least 2 tips from each other in returning to in-person. And then describe considerations to keeping some virtual presence in your local community. So, so without further ado, to be or not to be is not our question. Famous quote from William Shakespeare. Ours looks more like to meet in person or not to meet in person. That is our question. So as we look at that, let's sort of go back a year and a half and look at the landscape, okay? So chapter relations statistics, we had over 150 chapters. We had over 500 in-person support groups, and that included one group in Texas that was doing 82 all by themselves, in person, 82 a week.
Yes.
Facilitator training was on the rise. Okay, and it was all in person. There was no such thing as virtual facilitator training, which is our life right now. And then with our online support group statistics, and this is just sort of designed to tell you growth and not growth. So we had 6 online support groups, and we were getting ready for another 5 that were going to be around vets and geographically targeted. And then the average number of registrants to one of our online support groups was 18. And we got about 9 per group. Okay, so that sort of lets you know. We now have 37 weekly support groups virtually.
Oh, great.
Okay, and we'll talk more about those statistics later. So the next day, shelter in place happened.
Yeah.
And we had to turn on a dime. We had to literally go from this thing that we thought would never work, because that's what we said, oh, come out, it'll be good for you. You know, the attitudes that we had to go from that to this thing that we thought would never work. Nobody ever heard of Zoom in our world, or many people had not. Nobody heard of Google Meets, and all of a sudden, this is the way we were meeting. And so we've been that way. 95% of our chapters were shut down in in-person meetings, and then 100% thereafter. So like on March 14th, 94% were already gone. And so our world was turned upside down, because even though in-person meetings were shut down, mental health support was about to skyrocket. And Nicole, if I could ask you to just keep an eye on admitting new people. So what did we learn? Well, what we learned about virtual meetings at the chapter level is that online support groups are comparable substitute for in-person. Now, it's not, you know, we don't have human touch. We don't have, we do have eyeball to eyeball somewhat, but it is a substitute that's temporary, or for some, it could be permanent. And then different people show up online, you know, like, we'll talk more about that a little later. We even had people going back to old groups. They had moved away, and since the online happened, they went back to their old group because all their friends were there. So that was kind of a cool discovery. And then sometimes online support groups bring people from different cultural backgrounds. Something we had not thought of before was that they could come and not have the stigma that was attached, because they could just go on their computer or their phone, and there was no stigma. And so we might not have tried virtual in this bold way, particularly had we not been sort of forced. And now we know their value, right?
Yes, yes.
So has your chapter gone back to in-person meetings? I'm going to do a little poll. So I don't know if you all have done the polls before. Nicole, I need you to do the poll. So click on the poll button on the bottom, and you're going to do the first one. Have you gone back to meetings before? And you can read us results. Is everyone getting the poll?
Yes.
Yes. Okay. Nicole, could you tell us how many, what percentage has gone back? Can't hear you. You're muted.
67% said no, 33% answered yes.
Okay. Well, that's an interesting statistic. So a third of you have gone back
Yes.
to in-person. Very, very cool. Okay, so in thinking about your small gatherings, all right, so our support groups, according to the CDC, are considered small gatherings, right?
I think so.
And so we, yeah. Okay, so Ron is telling us that there were some virtual meetings before the pandemic. DBSA Hartford, or they call themselves the Nomad chapter as well. So what's the cutoff for small gatherings? The definition for small gatherings is that it would be like a family gathering. They don't give you a number. You know, when you go on their website, they don't give you an exact number, but they tell you it would be a small family gathering. It wouldn't be a big wedding like I went to. My family had a big wedding a couple of weeks ago and there were 150 people. That would not be a small gathering. So I want to share some of the information related to what the CDC is telling us. So here are the risk factors when considering going to in-person. The number of COVID cases in your community, are they increasing or decreasing? Are they high to begin with, you know? And then, you know, there's all the relevant data that's around that, that's about hospitalizations and deaths and all of that. So you want to be looking at those trends pretty carefully. Okay. And then the setting, is it indoor? Especially places with poor ventilation. If, you know, your local hospital has said, okay, you can come meet, and then they put you in the basement or in the church basement, there's no ventilation there. It poses more risk. Is outdoor an option even? And if you had outdoor, would people come? Because that's not exactly very private. The length of the event is relevant because if you're in an indoor setting for more than 15 minutes, the risks go up, even with social distancing. So if you look at the details of what this says, it says events that last longer pose more risk than shorter events. Being within 6 feet of someone who has COVID for a total of 15 minutes or more greatly increases the risk of becoming infected and requires quarantine. And I don't know if there are any Dancing with the Stars fans, but I just heard that there was a COVID, one of the dancing pros got it, and they're pretty sure that her partner got it too, because they were rehearsing that day. So, and think about how that could spread in your group, and then think about the effect of them having COVID and how that would affect their mental illness, or their mental health, I should say. And then the number and crowding of the event, like if they're putting you in a teeny tiny room and you have 20 or 30 people, okay, now physical distancing is a problem and you have a transmission risk. And then the behavior of the attendees during the event, you know, are they huggers? Seriously.
Yes.
And that's one of the things that we have all missed, right? Being able to just give somebody a big old hug. And certainly our people want that contact, especially with
Yes.
people who they haven't seen in a long time. So as you look at these, what are the considerations for us? There's a definite correlation. The local organizations should be working with state, local, and CDC guidelines to see what all the health departments are saying. And then what are the guidelines set forth by the facility regarding mask wearing and safety measures? Is there an outdoor gathering possibility? And would people attend? I said that a minute ago. And then if there is exposure, what is the chapter or support group's responsibility in contact tracing? We keep hearing that for everybody else, but now we're putting ourselves into a situation. If we're going in person, how do we handle contact tracing when we have this need for confidentiality and anonymity? And how do we handle that? And since people would be interacting with others outside their own household, which is part of the definition of small gathering, what considerations need to be made for physical distancing? So I'm going to stop there for a second. And that's a lot of information. Have you all thought about like all those of you who have gone back already, was this part of your process? Did you think about like all these different aspects? Kathy's nodding her head yes, so I'm going to call on Kathy, who already is unmuted, and I'm going to say, Kathy,
You can
What did
tell
you-
who likes to speak.
what did you do?
Here in San Antonio and in Texas generally, you all probably know about us down here. It's kind of wild and crazy down here on the state level, the political level, the local level, divisions, of all kinds. And the health, the health people are even like this. And so I'm going to just tell you how we have dealt with it for our immediate in-person meeting, and that'll simplify it for everybody. We were so happy with our in-person, very happy. We're going to continue that with, with Zoom. We're going to continue with Zoom. We already have 2 meetings. We've added another meeting a week. So we have 2 Zooms here in San Antonio and 3, another one that comes monthly. So what we decided with the in-person, where there was like a core group that just was crying about having in-person. Just, I need it. We fought them off for like 6 months. Okay, we really did, because my chair and myself, we are high risk, we're over 65, or we have an underlying condition. And it's difficult to tell young people this, but we just had to keep telling them this. They didn't feel this way at all. They didn't feel it. But we said, we'll wait, we want to wait. Well, our board decided this. We've got it all decided in minutes for the people, if you're ever interested in looking at what we decided. But basically, we decided that people had to be fully vaccinated before returning to our in-person group. And this has been widely promulgated with our membership. And we actually started having in-person meetings. And we are relying on people's good faith. We are not checking cards. We could be kind of rude about that, but we don't want to be rude about it. That just seems like a strain we don't, need as the type of group that we are. So, but my chair and I, we just looked each person in the eye as they came in, whether they were familiar or not, and said, "Are you vaccinated?" And we just went with what, if they said they were vaccinated, we just went with it and welcomed them. But everybody got, the look. So it's up to them to live with themselves, really. Who else?
Well, and it's really for them, because if you're
It's-
vaccinated, it's not a problem.
So, of course,
So they
there are
say.
those of us, there's difference, but there are the people certainly who are on a board. We have to have can take some of these safety considerations. We have to do it. We were concerned that people would come to the meeting and catch it and then blame us as a board. This is, it's kind of down, isn't it kind of sad? But that's kind of what it kind of came down to, was if we heard that somebody was going to blame us, we just have to have a rule, at least a written rule and a published rule for vaccination.
That
So
makes sense to me. And it makes sense that you considered all of that. But, vaccination is like the political hot potato.
sure.
There's so many directions that could go wrong. So
that's our
I think
compromise.
it was brave. I think it was a brave
Yes,
move. I see
yes, here
Alvin
in
has
Texas
a
particularly.
question. Yeah,
Uh,
Alvin has
yes.
a question. What is your
Right.
question,
I,
Alvin?
it was not really a question, but a comment I wanted to
Oh, yes.
review what
Of course.
we've done. We at early July resumed I voted in the poll. I said no, and I wasn't sure what I should say. But in early July, we resumed meetings for 2 of our peer groups. There were churches that were willing to allow meetings, and they met 2 times, 3 times. I'm not sure, and it seemed relevant, happy enough, and of course case rates were low then. but then Delta came on, and moreover, at one of the two groups, we subsequently learned that one of the participants had then tested positive for COVID, and we made people and the other participants in that group aware. But that's when the board considered again and decided to pause in-person meetings. And so at the moment we're still paused, but we've got plenty of debate, and no question we're going to continue virtual groups, but we're not sure whether we should allow those, and it'd probably be small groups. They were small groups when they were in person, who want to meet in person to go back. So that's a pending issue.
It's interesting because there are some groups in the chapter ranks that want to stay virtual. I mean, they are being intentional.
Well, in a certain sense, we certainly want to stay virtual. The question is what combination of in-person and virtual will we have? And for the moment, we were attempting on Thursday nights to have both, and we'll see if we can manage that when the time comes. By the way, I don't know what happened with my video, so my video is not working.
Well, all is forgiven, not a problem. So others comments, because we're in what I call the in-person meeting idea exchange. So that's, for you to talk about, tell us your ideas about one of the potential considerations that your group has done. We heard about Kathy's. What about the others who have already gone back to in-person? What was your process? Lillian, I see your hand up. Nice to see you, Lillian. Please unmute yourself so that we can hear what you have to say.
How you doing? Nice to see you too, Carla, and everybody else. So I'm from the Boston chapter, and we are out of the McLean's Hospital. So I had a meeting, a phone meeting with the people about getting us back in, and they keep pushing back our date. So it was supposed to be November. Now they're saying January. And it looks like people are going to have to be vaccinated. They want people to be vaccinated to go. It's a hospital, and certainly we can understand that. But there are people that are very resistant about that. They don't want to be made to have to get vaccinated. And I'm like, well, you don't have to get vaccinated. You just can't go to the in-person meeting. But again, I understand what Kathy says. It's like, you don't want to be the police. You don't want to be asking them to show their cards. So, I mean, you have to, I think we will have to go on the honor system, but we will have to wear masks unless things totally get better. So that's another thing. And we are going to keep a lot of our virtual groups. We run groups 7 days a week during the day, and then Wednesday's our big night, and then we have a Thursday night group too. So our big dilemma is going to be when we do go back, do Wednesday night totally go back, so we're fatigued at this point because we're running so many groups, which is great, but that's a big concern too, about when we do go back in person, how are we gonna, maybe it'll just be Wednesday night, but anyway, it is tough because, the day keeps getting pushed back, and I mean, I don't know, but anyhow, I'm looking forward to going back because I'm one of those people that likes to hug, so I guess I won't be able to do that right away, so I'll have to hold off on that.
Well, thank you. I will tell you that Boston meets in this big room, and so they have a bunch of different groups all meeting at the same time, and that's part of the dilemma. So we have lots of hands up, which is great. So Ron, I'm starting with you. Ron, and then Stephen, then Cindy, then Dave, in that order. So Ron and then Stephen. Ron, I need you to unmute. Can't hear you. I'm sorry, we can't hear you. Could you put in chapter box maybe?
Audio.
He's seemingly unmuted, so I don't know what's going on. Here, all right, unmute again. Maybe I muted you now. Unmute, no, didn't work. I'm sorry, could you put it in the chat box and I'll read it? No. Okay, can I go to Stephen?
Can you hear me okay?
Yep, so far.
Okay. Okay. Yeah, so our group has been meeting in person. Last summer, we tried 2 weeks in person during the kind of lull in cases in our area. I'm from Wichita, Kansas, in the
Mhm.
Midwest. So
Yeah,
for a long time, we had extremely low case rates, like everyone else, big hump over the winter, and then again with Delta now. And we had started meeting for maybe a month or so in person before the kind of Delta wave hit, and specifically the July 27th. I know because I was on vacation when I read the news, the CDC guidance about vaccinated people being recommended to still wear masks, being able to potentially infect other people. So we've been meeting for a while. There's definitely been, we're not a large group, but there among those folks, there's a large number who've been wanting to meet in person that I have been feeling, I think, underserved by the online groups. So we're currently meeting once a month in person. The first Thursday is the memorable way that I
Mhm.
promote that.
Mhm.
We kind of keep track of that via Facebook events, kind of a thing, and lots of reminders and stuff. But it's partially because I was worried that we would get too few people if we were meeting more often than that in person, and we don't really have. I'm the only facilitator. Well, we have about 2 facilitators for the group, but I'm the primary one. And so I figured we couldn't really handle more than that a month anyway. And our parent chapter, DBSA Overland Park, offers their group for online when we're meeting in person. So those people still have a place to go. But we have been requiring masks since that. Forgetting that July 27th thing there. So, but we're not asking for proof of vaccination. That's just the difference there. I figured it was going to be contentious, and we're in a pretty conservative area too. Maybe not so much as Texas, but or more, who knows? But either way, I think people the masks are at least a visual thing that you don't have to trust. And we do distance as well. It's a different setup than we did previously, and we usually have between 6 and 9 people or something at one of these in-person groups. But it's been working pretty well. And even with masks, because I was afraid people wouldn't be interested in that, they've still been pretty positive about it.
Well, and I think you need a bigger room, no matter how many people you have, you need a bigger room now. And you're going to be shouting across there. So let's hope there's a lot of privacy, because it's hard
Well,
to
we're in
have
the
a
Midwest,
support
so
group
we've
when
got a
you're
lot of
screaming
room, but-
through a mask and across the room. So thank you for sharing. Thank
Sure.
you so much. Cindy, I'm going to go to you next.
Hi, I'm part of a chapter in New Jersey. And Kathy, like you, I had quite a few members that were very antsy to get back in person. So they were pushing it. The facility that we were currently using pre-COVID was no longer allowing in-person meetings. So we had to find another place. And at that point, it was hard to find a place that was allowing in-person meetings. So we ended up finding one, but they required me to have insurance for the group, which I never had to have before. So that was a big ordeal. They also require first-time people going to the facility to fill out a COVID form that they're not held responsible. And they do have a sign-in where you do put your name and your phone number, just for specific for DBSA, our meeting. And I require people to wear masks. There was a big issue in debating whether I should ask for vaccine cards and trust people, whether they're going to say they've been vaccinated or not, the honesty policy. It got too complicated. I don't want to have to ask people because I think that's private. That's your own business. So I just made it everybody wear a mask. We'll have some social distancing in a big room. If you need a mask break, please feel free to step out of the meeting room, take your mask break. We also continue to do an online once a week as well. So for those who are not comfortable going in person, they can come to the online as well. We've been going since beginning of August, end of July, beginning of August. And we're averaging about 10 members, which is, not bad. And so far it's been okay. So far, so good, fingers crossed.
Yeah, what what they're doing is they're asking you for contact tracing. So 2 things I want to note based on what you said, Cindy. Number 1 is that when they're asking you for insurance, you need to be careful that it includes COVID, because a lot of the insurance policies that are being written for general liability and D&O are excluding COVID because of what we're living through right now. And so it really would be sort of useless to do that. So if you're going down that road, be careful that it does include COVID. The other thing is with contact tracing. One of the things that you may want to consider, this was just an idea I had, and you guys can tell me what you think of it once I talk to Dave, is the idea of having them put whatever name down they want to put, as long as you have a phone number or an email, because that's what's most important. So they can preserve their anonymity. I don't care if they put Minnie Mouse on there, as long as you can call Minnie Mouse and say, hey, you were exposed to COVID and this is what's going on. So just an idea. Dave.
Yeah, I'm involved with a number of behavioral health and cultural organizations. We're here in LA County, which is a high-risk area. We've had over 10,000 fatalities, which in theory is more than twice the total number of fatalities in China over that time period. Anyway, we got some risks. The organizations I'm involved in here in Southern California and on a California basis are planning through late in the fourth quarter to early next year. We're really assuming everything is going to have to be virtual here for that reason. Obviously, other venues are in a different situation. So we're meeting virtually, and it will be a choice of the membership. There seems to be a significant demand for having a hybrid setup so that you would continue with some online meetings, even once we get the opportunity to meet face to face. Partly LA County is huge. So there are people who really want to come to a chapter, but it would take them 3 hours round trip to get over there. So hybrid deals with that as well.
Well, when you're talking about hybrid though, are you talking about the complete package of what will be offered? Or there will be some virtual and some in person, or
very
and
good question. Right now, we are thinking of it from the point of view that we would have some days where they would be online meeting, and then some days where they would be virtual. The privacy issues get more complex, I think, when you're talking about hybrid, where you're broadcasting a person-to-person meeting. We are doing some work with SHARE, which is an umbrella organization in LA County that is an umbrella for AD plus self-help organizations. And they do a lot of hybrid stuff. So we expect to learn a lot from them over the next couple of months on that, and be happy to pass on any learnings to you in Chicago, Carla.
That'd be great. You brought up the traffic, and you'll see in a slide very soon that I was thinking of Los Angeles when I put this on there. But that's a really relevant point these days, because time is the money of today. So if you think about how valuable people feel their time is, time sitting in traffic to go to a support group meeting, that's an hour and a half, and you're in traffic for 3 hours is, no bueno, like just there are other things that they could be doing with their life. And so that's where virtual comes in. And I want to talk a little bit more about the virtual side of things now. So I have another poll, Nicole, so I'm going to call on your polling skills for the next one. And it's just a yes or no. And it's about, does your chapter plan to keep virtual post-pandemic? So are you all getting your polling? Nicole, did you find it? I can't hear you. You're on.
Yes, I am here. So I have the poll. It's still on the first question though.
You just scroll it down to the next one. You see it?
Okay.
Yeah, it's called like virtual meeting or something like that. Each of the
Virtual
questions.
support groups. Okay, yes, I got it.
Okay. Nicole's new to Zoom, so thank you for your patience.
Please bear with me, guys.
So are you getting your poll now? All right.
And we have,
Survey
does your
says,
chapter plan to keep at least one virtual meeting post-pandemic? 100% yes.
100%. Isn't that
Yes.
amazing? I think that's an incredible statistic for an organization that going into this adventure that we're on, that didn't think it would work. And so I want to read, just draw attention to what Ron was trying to tell us earlier, that they meet in a hospital. And they haven't given us time when we can start meeting, asking us to check back in a few months each time we contact them. We'll be following their instructions on how to return. Last we polled our facilitators, none were interested in facilitating in person. Well, that's a problem. That's a problem. And Kathy said that they're currently not meeting in person this week because the facilities had a closure due to COVID. And Dave said that they're similar to Ron's. So I think that the facilities are going to be sort of ruling the roost as far as in person is concerned. If they're requiring vaccination, I guess you're going to be required to do that. If they require contact tracing, you're going to be required to do that. So why have you guys opted to, I just want to show you my cool slide and then I'll take it down real fast. But why have you opted to keep at least one virtual meeting? You know, this is your idea exchange stimulus. So, Kylie.
Hi, I'm with DBSA Portland East Side here in Oregon, and we have had a lot of success with our virtual meetings. When you do the repeat session of this, I think on Friday, our board president, Jean, is going to speak, much more coherently than I am probably. But as soon as we started, I've really advocated for keeping at least one meeting virtual, just because we have had such a different range of people who were able to attend. We have people from other cities around Oregon. We have had people come from other states just because they've heard good things about our meeting, which is great. We had one member who moved out of the country and was able to still continue attending. And so it's been huge.
Isn't
and
she in South Africa or something?
Yeah, she was in Kenya.
Kenya. Okay.
Yeah. And it's just the number of people who've come in and been like, either my anxiety has been too high for me to attend in person, my transportation is unreliable, or my geographic area just prevents me from, driving 2 hours. It's been huge, and I'm really grateful we're able to consider it.
And with the start of virtual facilitator training, what happened is that Kylie's fellow member went through facilitator training so that she can continue the work in Kenya, which is very cool. I mean, like, who would have thought we'd be doing a support group in Kenya, if not now, then in the future? So that's pretty incredible. Alvin.
Our experience has been somewhat similar. At first, our numbers in group were perhaps down somewhat, and since then, our numbers virtually have gone up so that they're probably now comparable to what they were before, but they're broadly not the same people. The ones who come virtually skew younger, and they include people from farther away, and I think we've had participants from abroad and from states other than than the immediate tri-state or tri-district area around here. But it's also notably included a number of our alumni who, one, may have moved away to other areas. People do a lot of that here in DC, but also included people who couldn't conveniently travel into group, but were pleased to do so virtually, while there are others who regularly came in person who haven't come. You asked about facilitators. We actually, when we had a group meeting in DC, we had 2 facilitators who had not participated virtually who were happy to come in to facilitate, and they will remain available. So there are different crowds out there.
Yeah, absolutely. You know, it's funny because we only have about 5 minutes left. So I want to be sure to talk about this. Now, I want you to take a look at this slide. It could look very familiar to you. The content could be very familiar because the very things that we discovered are the very things that are the reasons to keep a virtual presence. The other pieces is, you're right. Alvin, you just said that your online groups skew younger. Our online groups, the national online groups, 37% of the people who attend those groups are under the age of 30. This is a demographic that we have been looking for years, and they're online. And that is the reason that we have not found them up till now. The other thing to pay attention to is the traffic thing. That is LA traffic, Dave Newfer, I want you to know. And because of the traffic issues all over our country, we have had more people interested in virtual because they don't have that issue. And then this last picture represents the DEI factor, because we are attracting a more culturally diverse base than we have ever attracted. And that is across the board. We are starting to find people of all backgrounds, which is the ideal, because we have skewed so much on the over 45 white woman. That's our demographic. 80% of our people in our last survey skewed that way. So we're trying to write things. And one of the ways we do that is programs like the Peer Apprentice program that Nicole is part of, and all of that. So do we have any last minute burning questions? We have 2 minutes left, and I have to end on time because I'd be a bad example. So any burning questions for y'all? Now I've turned Southern. Kathy Franklin. Any last minutes?
Well, I like to end these things, as Carla knows. I am so encouraged when I attend any of these meetings that are sponsored by National. I've been with DBSA for 21 years, and you toil around. San Antonio, we're the only chapter, so we kind of toil around here by ourselves, and we're doing okay by ourselves. But because of COVID and because of these Zoom meetings, I feel renewed and excited to see people across our nation that are doing the same. It's fun doing the same things that we've been doing for so many years, which of course it's handed down by our predecessors. I like to preach. Yeah. And here we still are, and we're continuing. It just amazes me because we're peers and we are workers and we are doers. And so it's just worth more than I can even express. So thank you very much for participating and choosing DBSA over so many other things that you could be doing. I'm happy.
I did not pay her. How I like to end is say this, that you are the heart of DBSA. And it's because of what you do that DBSA is what it is. And it's still the best kept secret. So we have much to do for outreach, but we're getting there. We're getting there. Thank you so much. I hope you enjoy the conference and all the sessions. And we want your feedback. So please let us know. Have a good rest of the day.
Bye.